My name is Alisha Mcfie.
And I'm Lindsay Surtees.
And this is how we roll.
So we're both registered nurses, so our role at CORE is very dynamic. Every day looks quite different. We get to do some direct nursing care with the individuals that we support, but we also do a lot of kind of behind the scenes of like health promotion and education.
It's definitely, like Lindsay said, like a lot of advocating. So sometimes we have different like doctors and stuff being like, oh, why do we need that? Well, I don't think this is necessary. And we come in and explain why that care is needed and how it should look for the people we support.
Kind of being like a liaison between like physicians and different like health professionals that the people we support access, to then like bringing that actually like into the home and being able to deliver it.
I started working at the hospital, actually in nutrition and food services, shortly after high school. And while I was there, I saw a lot of like disparities and inequities in the healthcare system. And I knew I wanted to be a part of the change and a part of something where we could make a difference. So that kind of led me into nursing school. I knew I wanted to work with more marginalized populations because I knew I could make a difference. So I supported at CORE throughout nursing school, and a lot of what I learned at CORE through the different like trainings we had, like MANT and gentle teaching, Safe Talk, like all that kind of stuff really helped kind of shape who I was as a nurse as well, and the care that I provided to my patients. Just the values that CORE has, the gentle teaching, it just resonated with me so much. I supported a couple of girls for about 5 years before I was in this nursing role, and I love them so dearly, and they really helped kind of guide me on this journey as well. And it just helped me see kind of where I could be useful in this field.
I feel like I always knew that I wanted to work with people with disabilities, and I've been doing that and supporting in some kind of aspects since I was a teenager. I worked with Easter Seals for like 10 years here and in Alberta. I've worked at a number of different, with a number of different organizations, and I really love being a part of this sector in whatever capacity. I decided, I guess, to go to nursing school and hoped that I could continue to like nurse in this field, and then this opportunity came up. So it's kind of like a combination of everything that I love. I get to still support people with disabilities, but also do it with like a nursing lens now.
We're able to connect with healthcare professionals and connect them with supports. We're able to help supports kind of understand the health of the people we serve. So we kind of act like a bridge in that way to kind of bridge that gap in healthcare where a lot of times, you know, they might see their doctor and then there's no follow-up. We're able to kind of be that bridge and say, okay, we saw the doctor, now we got to kind of follow up with that and do the things that the doctor has suggested. Just explaining to them how they can be their own advocate in their healthcare and how they have the say and the decision making to be able to kind of be in control of their own health. Mandy has been super instrumental in this at creating positive relationships with different healthcare professionals in the city and different kind of organizations. So we have contacts through like child and youth, we have contacts through Regina Mental Wellness, we have contacts through neurosciences, and just lots of different organizations where we're able to contact that professional, whether it's a doctor, a nurse, and that's been a really important part of just making sure that people we support get access to the care that they need and that they deserve.
Like, we're so fortunate to get to work with so many amazing healthcare professionals that have the same ideas and goals as we do in being like the best health outcomes for the people that we support.
So the DDNA stands for Developmental Disability Nursing Association, and Mandy and I are actually the only two nurses in the province who hold this certification, which means we just have a little bit more knowledge and a little bit more expertise on what the disability community needs for healthcare and kind of what that looks like. The DDNA was founded to basically bridge that gap, to provide education to nurses, to provide education to doctors, to occupational therapists, to basically any healthcare professional that's willing to learn. As the core health team, we really work as a team. We have myself, Lindsay, and Mandy are the nurses, and then we have Casey and Braden, who are family supports and counseling, and then we have Haley as well, who's our dietitian. We have so many just like different professions and different kind of expertise that we're all able to kind of come together and come up with a plan that works best for that person.
Holistic health, we want to see the whole person and not just an individual diagnosis of you have high blood pressure. It's a state of like happiness and well-being, like mentally, physically, spiritually, emotionally, socially, all those things. And well-being to each and every individual person might be defined differently.
Kind of what Lindsay was saying, like what's important to them, how they view their health and how they view health as a whole, and kind of support them through that, which is really amazing because we don't get to do that in other areas in healthcare. So I would say that's definitely like my favorite part of being a nurse in the disability sector, is being able to build those relationships with the people we support, and then being able to support their health through those relationships.